Well, as the Delta variant surges nationwide, there's an increased demand for a treatment that can keep high-risk COVID patients from getting severely ill. Naomi Ruckham has more on monoclonal antibody treatment.
Curtis Urban got COVID-19 despite being vaccinated.
I started having what I would consider to be kind of a normal head cold.
He called his doctor right away because he heard monoclonal antibody treatment could be beneficial.
I am a little overweight and I do have high blood pressure. So I'm in that, I guess, enough of that high risk category.
Monoclonal antibodies are lab-made proteins that mimic the immune system and work to prevent the coronavirus from attaching to cells. High-risk patients with mild to moderate COVID, ages 12 and older, are candidates for the IV treatment.
Monoclonal antibodies should be given to individuals within the 7 to 10-day period. When it progresses to severe illness, it's too late.
The FDA has granted emergency use authorization for 3 monoclonal antibody treatments. Dr. Raymond Razanable with the Mayo Clinic authored a recent study looking at nearly 1,400 high-risk patients with mild to moderate COVID.
Patients who receive the monoclonal antibody therapy have a 70% risk reduction in getting hospitalized within the first 28 days after the diagnosis. Very rarely do patients report side effects, and the more common ones are nausea, chills, fever.
And if it's going to help me, then I'm all for it.
Curtis says his COVID symptoms were mostly mild, and he was back to work 12 days after treatment. Naomi Ruckham, CBS News, New York.
After a recent surge in demand for this type of treatment, the federal government is now putting limits on drug orders and is making state health departments accountable for distributing doses.